Hi and welcome to Optimum TV. I'm Stephen Adams and today I'm joined by David Reynolds, CEO of LoQus23, which is developing a new treatment for Huntington's disease. Hello, David.
Good morning.
So May is Huntington's Disease Awareness Month, and I expect lots and lots of people will have heard of Huntington's disease, but not so many will know what it is. So in broad brush terms, can you explain what Huntington's disease is, please?
So Huntington's disease is an inherited neurodegenerative disease. It's autosomal dominant, meaning you inherit one mutant copy of the Huntington gene, and you will get Huntington's at some point in your life. Now, from a symptoms perspective, Huntington's usually has an onset somewhere around 30 to 50 years old, but it can be as early as 2 or as late as your 80s. And disease kind of symptoms wise, there's 3 kind of classic clusters of symptoms. The movement symptoms, where someone with Huntington's disease, at least in the early stages, can't really sit still and they have these uncontrolled movements which are sometimes described as dance-like, hence the old name for it, Huntington's chorea. But although they're the most obvious symptoms to somebody else, really the most debilitating symptoms to Huntington's patients are the psychiatric and the cognitive symptoms that go along with those movement symptoms and get worse and worse over about 15 to 20 years before a patient will die.
And people do die of Huntington's disease rather than with it, is that true?
Yes. Essentially, there's no effective treatment or cure that can slow the disease down. And as the disease progresses, it may be that somebody ultimately dies of choking or other aspects, but they're caused by the neurodegeneration that is the core pathophysiology of Huntington's disease.
Okay. And I understand Huntington's is rare, but not super rare. Talk about how common it is in the population and how that translates to patient populations.
So it's actually one of the more common inherited neurodegenerative diseases. In the UK, there's about 7,000 to 8,000 patients who have symptoms, like manifest HD patients. In the US, that would be about 30,000. So prevalence is roughly between 1 in 10,000 to 1 in 20,000. Estimates vary across the world.
Okay. The theme for this year's Awareness Month for Huntington's is behind the gene. So explain, if you can, the fundamental genetic drivers of Huntington's and what goes wrong in those who develop it.
So for those who are Huntington's disease gene carrier, their Huntington gene has an expansion of a repeated DNA sequence near the beginning of the gene that codes for the protein. So in most people, you'll have less than 35 CAG repeats. So it's a 3-letter repeated code, and you'll have less than 35 CAGs. In somebody who has the disease or will go on to develop the disease, you inherit usually between 40 and 50 repeats, although it can be much longer. And it's that expanded CAG repeat section in the Huntington gene that ultimately leads to having the disease.
Okay. And I understand that you can build up cumulative genetic damage in terms of these repeats for a very long period of time without actually exhibiting symptoms, but then something catastrophically goes wrong.
Yes, so what we've learnt and have much better understanding over perhaps the last 10 years, and this has come from kind of laboratory mechanistic studies, but also human genetic linkage studies, is we now understand that although a typical Huntington disease gene carrier will inherit between 40 and 50 repeats, during the lifetime of that patient, those repeats actually expand up to hundreds, and that's what ultimately causes the Huntington protein that's produced from that, the mutant protein, to be toxic and cause neurodegeneration. It also explains why the disease has an onset in midlife, because you've got to allow time for this long, slow process of what's called somatic expansion. So an expansion at an individual cell level of that CAG repeat in your Huntington gene.
Okay. A couple of months ago, I saw a very good movie, the Bob Dylan biopic, Complete Unknown. And a very moving scene. One of the first scenes is where a young Bob Dylan goes and tracks down his hero, the American folk singer Woody Guthrie, who has Huntington's and is in, well, the final stages of disease, really. And that painted a very vivid picture of a pitiless disease for which nothing could be done. Now, obviously, this was 60 years ago. It was the mid-60s. And I imagine things have come on since then. But what are the current treatments for Huntington's?
So they haven't, Stephen. Certainly care, supporting the community, societal understanding of neurodegenerative diseases has improved. But sadly, the treatments that we have available for somebody with Huntington's are not that much better these days. So there are a number of things to help with the movement symptoms, and drugs used to treat depression or psychosis can help manage some of the other psychiatric symptoms. But there is no treatment that is targeted just at Huntington's that slows down or stops the disease progression. And that's what we're working on at LoQus23.
Okay, so finally, David, talk a little bit more detail about LoQus23's approach and how the technology works to try to arrest Huntington's, the development of Huntington's.
So Huntington's disease and the degeneration of your neurons in certain parts of the brain is caused by toxic Huntington protein. But that's stage 2 of a process. Stage 1 is what I mentioned earlier, the somatic instability, the expansion of the repeat sequence in the gene itself. And that's mediated by aberrant DNA mismatch repair processes. So these are processes that are supposed to keep your DNA in good working order throughout your life, but actually if they go wrong can lead to disease. And this process is understood from human genetics, and one particular gene, the MSH3 gene, stands out very strongly from all the scientific data as being a great target to have the ability to slow down or stop Huntington's disease, as well as being safe. So at LoQus23, we're targeting the MSH3 gene, or more accurately, I should say, the protein that is produced from that, and that is a complex with another protein. It's called mutase beta. We're inhibiting its function to prevent aberrant mismatch repair expanding the CAG repeat. And we think that that should be able to slow down or stop the disease.
And if you gave this early enough, would you be able to stop it from ever developing? Is that a possibility?
I think that is actually quite a likely possibility, Stephen. Now, our first clinical trials will need to be in patients with Huntington's disease symptoms, so we have something to measure and prove that it can slow down the progression or stop it. But then the next step would be to go a stage earlier and treat people who we know have an expanded repeat. And there are things that we can measure from MRI scans, for example, to show the disease process is ongoing, but they don't yet have debilitating symptoms. And if we can slow or stop that progression, then somebody who is a HD gene carrier can potentially live out their entire life without developing symptoms.
It's fascinating. David Reynolds of LoQus23, thank you very much for shining a light on Huntington's disease.
Thank you, Stephen.
Are you watching Optimum TV? In our bite-sized episodes, we talk to European life science leaders about the hottest trends, innovations and capital market developments in the sector. To subscribe, visit @OptimumComms on YouTube. You can also watch all available episodes on our website, optimumcomms.com.